I'm Joshua Safer, the Executive Director of the Center for Transgender Medicine and Surgery here at Mount Sinai Hospital. Thank you for joining us. Well, like for everybody, there is anxiety among transgender people with regard to accessing care for the things that are currently in progress, along with what the implications will be for that care that's disrupted and has to be delayed suddenly. The Mount Sinai Transgender Program luckily has been able to set up telemedicine and video visits, like many of the other programs at Mount Sinai. And so we are able to see our patients in follow-up who have urgent needs. We actually have our clinic open with a skeletal crew for urgent needs in addition. So our patients who, for example, had recent surgeries and need post-operative care, or our patients who get injections of medications that can't be stopped, have places to go if they're otherwise in a safe position to do that. Uh, in terms of our other patients who just need regular follow-up visits, we can have them call in and use our video system in order to have conversations around lab tests and around refills and such. Transgender people, on average, have weaker economic situations than the rest of the community, the rest of the population, and so transgender people are more vulnerable to the economic disruptions that are going on right now with regard to COVID than are others. And I think we do have to be mindful of that. People losing their jobs or having jobs where they're paid for being there and the there is closed currently. It's been a very high priority for the transgender program to continue to have access to our mental health support and to our social workers. So even though those are video visits now and telephone visits, we're aware that this is stressful for anyone, but it's even more stressful if you are anticipating some sort of medical procedure, let's say a surgery, and now have that deferred. And I think we have to be mindful of the fact that while this is happening to people with surgical needs across all sorts of areas, for transgender people specifically, the situation is superimposed on their previous reality, which was that, first of all, care wasn't even delivered just a number of years ago. And that means that people had to actually advocate for their own care. And even now, and Mount Sinai really has been a leader in this regard, we're still not at the place where our access to care is good enough. And we're expanding probably better than most. In fact, I know that we're expanding better than most, but it's still the case that access to care is not where we want it to be. So then to take that situation and suddenly have this massive disruption is especially a challenge with regard to transgender care. And we're dealing with people who weren't previously completely trusting the system to do the right thing. All of a sudden, the system shuts down, and the question is, how much does the transgender person have to fight to make sure that their care doesn't disappear? They're not completely trusting us. The good news with regard to hormone therapy is for anyone who already is on some sort of hormone treatment, several months of delay getting to the provider is not going to be a huge concern. We can manage that with televisits, we can manage that with video visits, we can renew prescriptions and make sure people don't run out of medication. And so we can keep things stable as far as that goes. For people who are in the midst of titrating to a certain level, we certainly can check lab tests if people can get out to our laboratories, which are still open, and get their testing done and make those adjustments. So that sort of thing, we're able to continue for many of our patients. Yeah, bad luck for our transgender program. New York has been especially hard hit by COVID, and although those of us who work in the transgender program, for the most part, are not the specialties that are the most needed for fighting COVID, we are a key reserve for our colleagues at Mount Sinai in terms of treating the pandemic. And so that includes many of us working in COVID-related efforts. We have our surgeons covering emergency rooms around the city. We have our surgeons in ICUs around the city. Our insurance person, just as an example, is doing transport at one of the Mount Sinai affiliate hospitals. And so that has resulted in some diversion of the people in our program from providing care. So the good news is that Mount Sinai is not just a leader in providing COVID care. We are also a leader in providing transgender care, and we have a big program that already was in place prior to all of this. And what that means is that as we are able to reopen in the coming months, I think will be less disrupted than many other transgender programs. We will have greater capacity to catch up sooner. We already had made the commitment to expand access so that transgender care is delivered in the way that it ought to be, and we continue to have that commitment. We will get back on that track in a number of months. And it's important for people to recognize then and to listen to the fact that I'm saying that the disruption is months. This is not going to turn into the situation that is still true with other programs in other parts of the country, or with care in the past where people were waiting years for services. We are having some disruption for a few months, but we will get back to where we were later in the year, and we will move forward with our care.